Falls by the elderly are very common, but many falls can be prevented. Hi, I'm Kathy Getrist, and I'm an instructor in community health. And today's topic of discussion is going to be about fall prevention and alternatives to the use of restraints. Currently, falls are the leading cause of death, illness, and injury in healthcare facilities. More than half of all residents in a nursing home fall on an annual basis. In a hospital setting, 10% of older people who have fallen die before their discharge. 1 in every 5 falls ends in death of persons that are 85 years of age or older. If not death, falls oftentimes will cause a downward spiral. I'm sure many of you might have an example of a grandparent who has sustained a hip fracture, for example, following a fall, and the course following that episode ended up with their death or disability in a nursing home. The statistics that I've just reported may change, but the harmful effects of falls remain constant. Falls are bad for everybody, not just for the resident. A person who has fallen and sustained some injury makes your staff, you and the rest of the staff's job harder, and can even lead to legal action in the form of a lawsuit against your facility. Falls increase health care and insurance costs as well. In the United States, the total cost of falls is estimated to be well over $100 billion, with a B, dollars per year. But let's look on a more positive note about falls. By preventing falls, you can help the resident maintain the best possible physical and emotional health. Well, why do falls occur in the first place? There are 2 main factors. The first factor is the resident themselves. Many conditions, disabilities, and medications can contribute to a fall. The mnemonic, "I hate falling," that you have there in your student manual identifies the key reasons why a resident will fall. First, inflammation of the joints. Someone who has rheumatoid arthritis, has swollen, painful joints, is much more susceptible to falls than others that don't have that. Hypotension, which is low blood pressure, causes sometimes people to become lightheaded and can fall as a result of that. Auditory and visual abnormalities can be problems with hearing. Someone can be working behind an individual, maybe because they have hearing loss, they aren't aware of them. They turn around, become startled, and as a result fall from being startled. Tremors, another reason why a resident might fall. Tremors are the shakiness that you see with people with Parkinson's disease and other problems, much more susceptible to falling with that. Equilibrium problems is another reason why people fall. An inability to sense their balance, and they are frequently fall candidates. People with foot problems. For example, if someone has numbness or tingling due to nerve damage, could be from multiple sclerosis, for example, it's very difficult to even know where the floor is and where your feet are when they're numb. Arrhythmias or other heart problems can cause problems with lightheadedness and dizziness. Leg length discrepancies. That simply means one leg being longer than the other, causing a limp, and that precipitates falls many times. A lack of conditioning. Many of these folks do not participate in any kind of a regular exercise program, so their muscles are weak and they're frail and much more susceptible. Illness, for example, diabetes, a chronic disease that sometimes causes hypoglycemia or low blood sugar. When someone has an episode of low blood sugar, they have disorientation and dizziness. That certainly can be a factor in their falling. Nutrition problems. When people are not eating well, they're malnourished, their muscles become much more weak, and bones are brittle because of loss of calcium, and very possibly could fall. And the last are gait difficulties. Gait simply means whether you're walking, skipping, hopping, and such. Their walking becomes much more difficult if they've had paralysis on one side of their body, for example, from a stroke. In addition to the resident being a factor, having falls, the environment is the other factor. Most falls don't just happen. There is a precipitating trigger that causes an accident. I'd like to talk with you about some of the common triggers in the environment. The first are ill-fitting shoes, or shoes that have just been slipped on, maybe in haste and the laces have not been tied, or someone that has floppy slippers and maybe shiny soles that don't have a good grip, certainly predisposes a person to fall. Poor lighting, both during the day and at night, can cause falls. Slippery floors, another thing. Not only floors that might have water on them or snow that's been brought in from outside, but also highly waxed floors can cause patients to fall. Medications that are associated with sedation or lowering blood pressure can be a factor. And personal items that are not within reach. Sometimes the phone will start ringing, the patient is in bed, and the phone is too far away for them to reach. They really want to get that phone call, and will stretch more than they should and very possibly fall in an effort to try to obtain that or any other item that's out of their reach. Restraining a resident is not the answer in these situations for patients that are fall candidates. There are lots of other interventions that can be tried. If you recall, restraints would be the very last resort. These other strategies are much more appropriate and available, and I would like to cover some of those strategies with you, but bear in mind there are many, many others. Always leave the bed in lowest position when you are finished with your care. Adjust any protruding objects like bed wheels or a bed gatch handle so that the resident doesn't get up from the bed and accidentally knock into them. Keep the pathways free of any clutter from any equipment that might be or supplies that would be in the hall. Wipe up any spills immediately. Encourage residents to use the corridor rails when ambulating. All health care facilities, regardless of whether the individual is in a hospital, in a CBRF or an assisted living facility or in a nursing home, all have corridor rails for their convenience. Provide adequate lighting both during the day and at night for patients. Turn on switches for patients to be able to see clearly in bathrooms before attempting to use it. If light bulbs have burned out, be certain that you get a hold of the maintenance department or assist in putting in new bulbs yourself. Check the resident's clothing for fit and safety. Loose shoes and loose shoelaces, any floor-length robes, and wide type of slacks all increase the incidence of falling. Have residents wear non-skid shoes or slippers for walking and transfers. Care for bathroom needs promptly. If a call light is put on and it's not attended to quickly because of the urgency that the patient is feeling, they may, out of desperation, get up and go to the bathroom unattended. Another thing that you can do is if a person has bowel and bladder problems, maybe it's best to just have a bedside commode for the patient, or to have a bedpan or urinal right there at the bedside for their use. Stay close by residents using tubs or showers. Be sure that the grab bars next to toilets and the grab bars that are in the tub and shower area are secure. Ensure that walking aids such as wheelchairs and walkers are used properly and are in good repair. Be certain to remove footrests. Have them either swing away from the wheelchair or literally remove them before and after a person exits from that chair. Have personal items within reach of the resident. That means things like the call light, fresh water, their phone, possibly a purse for women. Want to have that close by, a Kleenex box, anything that's of importance to the individual, have so that they can reach it by extending their arm. And finally, have residents use eyeglasses and hearing aids as needed. Some residents are more likely to fall than others. These folks are called high-risk patients. Many facilities have fall risk assessment forms that help nurses score residents on their risk of falling. They do this on admission. When people are admitted to a facility, the nurse completes this fall risk assessment, and then he or she also completes this form periodically through the stay of the individual. It might be when there's a change in medication or a change in treatment or any other condition. There may need to be an update of this fall risk assessment. Residents who are at high risk for falling are those that are confused or have some other form of dementia, are over the age of 80, and this is thought because they're generally more weak and frail, and as a result are debilitated and much more susceptible to falling. Patients that have bowel and bladder problems that require frequent trips to the bathroom understandably are more at risk of falling. Those that have a history of falling within the last 6 months are more susceptible to falling again. Someone who has impaired senses, not only an impairment of vision, but also an impairment of hearing, it might be an impairment of their sense of touch, all predispose the person to falls. People that have gait and balance problems tend to stumble and run into things much more easily than others do. And those folks that are on certain medications, the medications that predispose someone to falling most commonly are sedatives, anti-seizure medications, narcotics, and all of these medications can cause dizziness and drowsiness, as does a medication such as a blood pressure pill that helps lower blood pressure. Ways for you, the caregiver, to help. For people that are at high risk of falling, it's probably a good idea to put them closer to the nurse's station. There's a lot of activity that usually happens around the nurse's station, and that means there are many watchful eyes to be aware of patients if they are close to the nurse's station. Set up a bathroom schedule to automatically toilet someone every 2 hours, every 3 hours, if there is frequency of urine and urgency that goes along with it. There are special pieces of equipment for use when there is a high risk for an individual to fall. There's much technology that's available now for your use. I'm going to just cover a few of the items, but know that there are many others, and you will probably see many others in the facility where you work. The first is a bed chair alarm. This is a pressure sensing device, and as a resident attempts to get out of bed or the chair, an alarm is sounded to alert the nursing staff that that has occurred. The second is a side rail wedge or side rail wedges. Usually they use multiple ones. They're used to remind a confused resident not to get out of bed without help. And it's also used to close the gap between divided side rails. A low bed. A low bed places the bed about 5 inches from the floor. Usually there is a mat that's on the floor right next to the bed. A bed cane is an attachment on the bed that provides support to the resident who's getting in and out of the bed. The most common and devastating injury resulting from falls is a hip fracture. More than 20%, that means 1 out of every 5 hip fracture victims dies within the year. Another 20% spend the rest of their lives in nursing homes. These gel pants, as you're seeing now, are hip pads that cushion the hip joints and the long bones of the legs and help prevent injury when the patient does fall. A wander guard is an alarm bracelet worn by the resident that alerts the staff when a confused resident attempts to exit their unit where they're living. A posy grip is a material that's cut to the particular size that's wanted, and it's placed in a chair underneath the resident, and it grips to the clothing and prevents the individual from sliding down and out of the chair. The saddle cushion helps maintain posture and prevents residents from sliding down in the chair. If a fall occurs while you, the caregiver, are ambulating a resident, never try to stop the fall. It's just too easy for you to hurt your back by trying to hold the individual up. So it's better to allow the individual to rest against you, to lean against you, and you assume a wide base of support. That means your feet should be between 10, 12, 14 inches apart. And then lower yourself as well as the resident to the floor by sliding them down your body while protecting their head with one of your hands. Always stay with the resident while calling for help. Don't move the resident until the nurse has checked the resident to be sure that there are no broken bones or any other injuries. If the nurse instructs you to do so, then it's perfectly all right to assist the resident to stand, and always be sure when doing so that you use good body mechanics in doing so. Provide reassurance to the individual. This is a very frightening experience for residents to fall. Many times following a fall, they're much more reluctant to get up and participate in any activities, and you're going to have to use a little bit more encouragement to get them up again. Always be certain, too, that you put the call light within easy reach of them so that they know that you are easily available. Assist then in completing the special incident report as directed by your facility. There are different forms of incident reports. An incident report is just a form that's completed by you and your supervisor that describes exactly what happened leading up to the fall and any subsequent injuries that might have occurred. Now I would like you to watch a demonstration of caring for a falling resident. Caring for a falling resident. Assist the resident to dress and put on her shoes. Apply the gait belt snugly and securely, as well as any needed adaptive equipment such as a sling. Assist the resident to stand, grasping the gate belt with an underhand grasp. While holding the gate belt at the resident's back, walk slightly behind and on the resident's weaker side. Encourage the resident to keep her back straight and head up. While walking with a resident who begins to fall, allow the resident to lean against you, grasping the gate belt firmly. Assume a wide base of support, placing your feet 12 to 14 inches apart. Keep your back straight, bend your knees and hips. Gradually lower yourself and the resident to the floor, protecting her head. Call for help while staying with the resident. Do not move until the nurse has checked the resident. Follow the nurse's instruction. If indicated, assist the resident to stand using good body mechanics. Reassure the resident and assist with comfort measures. Make sure the call light is within reach. Wash your hands. Document the fall as indicated by your facility policy.